Assalamualaikum and good afternoon. The name is Today my partner and I would like to explain about our topic, which is obesity in Malaysia. Okay, first and foremost, do you guys know what obesity is? So, obesity is a medical condition where excess body fats accumulates to a level that can harm our health. So, what are the causes of obesity? There are a lot of reasons why obesity has become so common in Malaysia. So, one major factor is urbanization. So, many people work long hours at desk job, leaving little time for exercise. And busy lifestyles also lead to more fast food consumption since it's quick and convenient, but often high in calories. So let's move on to the graph. So this line graph shows the projected increase in obesity rate for different groups in Malaysia, which are men, women, boys, and girls. This graph was taken from World Obesity Atlas 2023. This ensures that our content is very trustworthy, empowering our audience to tackle this important issue with confidence. So the horizontal axis represent the years from 2020 to 2035, and the vertical axis show the percentage of people expected to be obese. So in this graph, we can see the data show a clear upward trend in obesity for all groups. So boys are projected to have the highest obesity rate by 2035, reaching around 42%, followed closely by women, who are expected to exceed 35%. And men and girls show increases but at a slightly slower rate. By 2035, men are expected to approach 35% and girls around 30%. So, the most significant point in the sharp increase, especially among boys and women. So, this rise could be linked to lifestyle changes such as more sedentary work and increased access to high calorie food in urban setting. It is clear from this data, the obesity rates are likely to continue rising, leading to potential health issues such as diabetes and heart disease. So, this graph clearly indicates a concerning rise in obesity for both adults and children in Malaysia. This trend may lead to increased health risks like diabetes and heart disease, emphasizing the need for public health measures to counteract these projections. So next, I will pass to my partner Anis Farahia to continue the presentation.
Okay, let's move to the second graph, which is projected economic impact of overweight. This graph shows how the cost of overweight issues is expected to grow over the years from 2020 to 2035. It breaks down the economic impact to different areas. The highest cost is presenteeism, which is in green color, due to reduced productivity at work, followed closely by premature death, the red color, which reflects the economic loss from early death. Absenteeism, yellow color, where people miss work due to health issues, ranks slightly lower. Healthcare costs, dark blue, and other health expenses, light blue, are the smallest but still grow steadily over time. Altogether, these costs are projected to reach nearly 22 billion by 2035. In total, by 2035, if things keep going this way, this economic impact of overweight is expected to reach nearly 22 billion. The biggest costs aren't just from healthcare, but from lost productivity and lives cut short, which affects both individuals and society as a whole. This topic is related to my grandfather's health conditions because he is obese and has a heart disease. He has to take a lot of tablets of medication per day. He also has to limit his water intake for about 500 to 750 ml a day, including fruits and watery food. This is related to the healthcare cost. So my family have to spend a lot of money for his medication. In conclusion, obesity is a complex issue that raises the risk of serious disease like heart disease and diabetes, adding a growing financial strain. If the government doesn't take action, the cost could reach nearly 22 billion by 2035, largely due to loss of productivity, early death, and rising healthcare expenses. Tackling this challenge means encouraging healthier habits, creating supportive environments, and implementing strong public health policies, especially for young people to help lower obesity rates and build a healthier future. Thank you for listening. That's all from us. Thank you.
Okay, thank you for your presentation. Okay, good job. All right. Okay, let's have thank you for